Health Talk, brought to you by Rapides Regional Medical Center. If you've ever had a loved one diagnosed with diabetes, you know. You've heard the warnings about blood sugar levels, about eating a healthy diet, and paying extra attention to wounds, especially those on the feet.
The most common type is a diabetic foot ulcer.
What makes wound care tricky is that most patients with diabetes are also diagnosed with heart disease.
We actually do a specific screening exam here in the clinic for the arterial blood flow. If the arterial blood flow is not adequate, then the wound's not going to heal, and it doesn't matter how good the blood sugar is. It doesn't matter if there's an infection present or not. It is not going to heal unless we have good arterial flow.
Approximately 25.8 million Americans suffer from diabetes, and 15% of all diabetic foot ulcers result in amputation.
The first thing is to prevent an ulcer from forming, and prevention is facilitated by making sure that the feet don't have any blisters or sores. The socks have to be in good shape. The shoes are appropriate for the person's feet.
Patients should also know that if they have a question about a hard-to-heal wound, they do not need a referral to visit Rapides Wound Healing Center.
Once it gets past the point where a person's got an ulcer on their foot, then they need to immediately see a healthcare provider. They can see their primary care doctor, they could come to our emergency room or one of our urgent care clinics, or they can call this clinic directly to come in and get an assessment on their ulcer.
To schedule a wound evaluation, call 769-4500.